preparing. Okay. Hi, everybody. Thank you for being here and welcome to Heartland Health Center's Facebook Live about kink. I'm so excited for this conversation and for all of our speakers. So I'm really excited and hoping that you all will feel the same. I am Amanda Montgomery. I'm the manager of community health education here at Heartland. So I get to help put on a lot of these conversations. And today I'm just going to be monitoring the chat. So if anybody has questions or comments or anything, feel free to add them and we will get them answered at the end. Also, any resources that come up throughout the conversation, we'll also put those in the chat, but feel free to leave any questions or comments there. And before we get started with the conversation, I will let everybody introduce themselves. So Figaro, do you want to go first? You're next on my screen.
Sure. So my name is Figaro, and my journey in kink started about 2008, primarily in puppy play and leather. I've been involved in several social organizations, as well as been both a regional and international title holder. So Northwest Puppy 2014 and International Puppy 2015. And currently I serve on the board of both the Vancouver Pups and Handlers and also the Titans of the Midwest, who are centered around now where I live in Chicago.
Awesome, thank you. And then Landi, would you like to introduce yourself as well?
Sure. I'm Landi Cranstoun. I'm a family doctor now in New Zealand as a general practitioner. And I practice pretty much undifferentiated primary care. So I'm not a specialist. I'm not just seeing kinky patients. But that said, I have taken care of a fair number of kinky patients. And I do a lot of work teaching other physicians how to interact with kinky patients to avoid stigma and create safe spaces.
Awesome. Thank you both so much for being here. And I'm going to pass it over to my wonderful coworker, Dr. Anuj Shah. He is going to be asking all the questions and moderating this conversation tonight. So Anuj, if you want to introduce yourself and take it away, that'd be great.
Thank you so much, Amanda, and thank you, Figaro and Landi, for joining us. And my name is Dr. Shah, Anuj Shah, and I am one of the family physicians here at Heartland Health Centers. Much like Landi, I'm undifferentiated, meaning I see all variety of patients, and my pronouns are he, him, and his. And once again, I want to really thank everyone who's joining us, and especially our two wonderful guests. And really to get started, I want to just ask a basic question about what is kink?
Well, I'm happy to take a swing at it and then Figaro can edit because it's one of those questions that doesn't have a precise answer. So for the clinicians, it is usually, it's ways of erotic expression that aren't acceptable to the dominant culture. So depending on where you are, it might be different. In some cultures, oral sex is kinky. In other places, you know, you have to be whipping somebody before it's kinky. So it's a lot. BDSM is kind of a lot of what's encompassed in kink, although there are things that are kinky that aren't BDSM. So BDSM is bondage, discipline, sadism, masochism, and then some people add from the middle two letters, dominance and submission. And then outside of that, you have things like role play, you know, like being a pup would be a role play type thing, and lots of fun, creative ways of being erotic with other people. Or by yourself.
Yeah, I don't know if I have much to add. That was that was just like that was perfect. But yeah, I think I really just want to highlight the fact that it really does vary kind of based on what your societal kind of norm is wherever you are as to what can be considered kinky. Because there's a lot of stuff portrayed in general media that in some places would be considered really kinky and for a lot of us just isn't.
Yeah, and you know, some terms came up in that definition that I'm just kind of curious about and what some of the differences are. So you know, BDSM was mentioned, and you know, I've also heard the word fetish. What is the difference between kink, BDSM, fetish, and other things you know that have come up?
I will, if you don't mind, I'll take a swing first, and then please feel free to edit. Um, I think that kink is a really great umbrella term, but sometimes can get a bit confusing because people try and kind of apply it everywhere. But BDSM, those kind of pieces, bondage being very specific and action based, um, things like dominance and submission, really kind of playing around with power dynamics within interactions between folks. All with consent and everyone being on the same page. But people, it can be as simple as someone making certain decisions, like oh, they always choose where we eat, kind of a deal, or it can be way more kind of rigid and formatted, into things like this person does all of these. And in fact, not unlike a lot of relationships just in general, but it's just a little bit maybe a more codified and also just noticed. But there's very often a dominant and or more dominant party in any kind of relationship. And then fetishes tend to be kind of the more specific things or actions kind of within all of that. And at this point, I will throw it on over to Landi.
Kind of from a completely different, background. So fetish, sadism, and masochism are all terms that were created in kind of the 19th century to pathologize people who are kinky. Kink is actually a term that arose within the community itself to describe itself. And so when you use BDSM, you have to realize on some level that you're absorbing some terms that were intended to be pathologizing and that are still used in pathologizing ways by physicians. And so I think for physicians and other providers and the mental health professionals, it's best to avoid using those terms, because when you use the term sadist, there's a really good chance that you may be drawing on ideas that are from this pathologizing tradition. Whereas when kinky people use those terms, they're used as reclaimed terms, right? So just like queer, when somebody says I'm a sadist, they're meaning something very different than what a psychiatrist means when they say this person is a sadist. And so just from like the perspective of normalizing in clinical settings, kink is not a pathologizing term. And so that's kind of a nice thing to keep in mind when you pick your terms as somebody who isn't from the community.
And thanks for bringing that up, Landi. And that leads to my next question, because what you brought up is sort of the history of how kink has been viewed in the medical context. And I'm wondering, in general, what is, I'm sure this could go on, there's probably courses on this, but what is a brief history of kink, and then leading into like a little bit more into like kink in the medical sphere, which you kind of already mentioned. But what's a brief history if I was interested?
So there's two ways we could take that question. One is a very interesting question, which is what is the history of the leather community in the United States, which Figaro could probably give a better answer to than I can. And the other is how was kink conceptualized historically, and how did it become a sexual identity? So which one do you want? And then that'll pick who talks.
Let's start with the second and then go with the first.
So I've got to say the first one is actually far more interesting as stories go. So the medical, what happened? So in the mid 19th century or so, acts that were previously kind of governed by religion and social norms became objects of study from the medical establishment, and in particular sexual things. So things like homosexuality, fetish, sadism, masochism, all of these things start to be talked about for the first time as concepts. And with the discussion of them as pathology, so we're creating a disease, right? We're saying this is a disease, encompassing anything, by the way, that wasn't a man having sex with a woman with the goal of procreation within a legally recognized relationship. So this is very heteronormative, both pathologizing homosexuality and pathologizing in the same breath all of these other non-normative sexual interests. So in addition to defining these diseases, they defined a particular sort of person who has these diseases, a pervert, okay? And so we have these perversions. They later get called sexual deviances. Then it becomes paraphilias, which is probably how you learned it in medical school. And then you have this idea. So there's this creation of a person, a pervert, and a medical model that sees these people as essentially deranged. And then sort of in DSM-4, so for the medical people, right? So there's this very clear definition of paraphilias as being diseases. And then there's this revolution with the latest version of the manual that psychiatrists use to describe people as sick. They differentiate between paraphilias, like masochism, sadism, which are just unusual sexual interests, and the disease. And in order to be a disease now, you have to either be distressed by it or you have to do something non-consensual. So very similar to where homosexuality was in the 70s. Just to say, where are we now? Well, we're still not completely out of the woods with pathologization. I still get letters from therapists describing my patients, and I quote, sexual deviances.
Wow.
So just to say, we aren't out of the woods, but I think we are starting to make headway.
Yeah, and it's very shaming, not only, in the general community, but even so much so within the medical community, to people who, are living their best lives. So, kind of thinking then kind of transitioning into the history of the leather community in the United States. Figaro, let me know.
As with everything, there are roots kind of in a lot of places. But with the current kind of understanding that's very dominant in the United States, really we see kind of the modern leather community coming out of post-war, particularly in places like, and the West Coast tends to take credit for a lot of it, although it's not always, but most of the stories I know are from the West Coast and from San Francisco. But you end up with a lot of folks there after the war, or if they were discharged for being gay, for example, if we're talking about the gay men's community. And so you end up with kind of a surplus of people that have all gone through Treasure Island. And they're there and they don't really have anywhere else to go, because if they've been discharged for being gay, they can't really go back to their families at this point. And so you start seeing kind of communities start. And what's interesting is that, kind of the original, although I hesitate to use that word because sometimes people like to add a lot of things to this and pass judgment about what's right or wrong. But kind of OG leather, as it were, was very much like James Dean. Like, maybe you had a pair of boots, but you were in jeans and a white t-shirt. And maybe if you had the money, you had a leather jacket. But what you start to see is organizations form modeled after motorcycle clubs, kind of around this, again, speaking from kind of the MSM standpoint, kind of modeled around this idea of masculinity and kind of taking some of the lessons of military and what people were familiar with a little bit further. That kind of grows, and we see then that's why a lot of kind of older leather clubs and fraternities and things like that are actually still called motorcycle clubs, because they kind of took pieces from the areas and things that they saw around them and kind of created their own thing. So you'll find, if you were to be at a large leather event, for example, that there will be lots of back patches and things like that, which symbolize either clubs or familial relationships or titles. And this is something that actually drew really heavily from the history of motorcycle clubs, which still exist in a, outside the kind of kink leather sphere. They still exist and are pretty popular today. So we kind of get these things. There's a lot of stories. A lot of them are apocryphal, but they're great for kind of points. For example, the origin of puppy play. There's this largely apocryphal, I've not found any evidence of it, but a story of a soldier who was in a POW camp for a while and was kind of really abused. And when he came back, he couldn't really speak or do anything, but he paired up with somebody and basically acted as his dog. And, it's actually kind of a strangely heartwarming story. But again, there's kind of a lot of apocryphal things that go into that history, but that's a really quick down and dirty history from my perspective.
Thank you. No, that's very interesting. You mentioned a couple of things earlier, and I feel like a lot of terms are coming up which bear to be defined. One that came up earlier was submissive and dominant. And from someone who maybe is just learning about this, I would be like, oh, I know what submissive means. I know what dominance means. Does it have a different connotation in within the kink community?
I mean, it definitely does. It's from my perspective, at least, and from my experience, it is. It can be a lot more formalized and kind of one might think it's more rigid. Again, to really communicate that generally the only successful relationships and the healthy ones are the ones that have consent and conversation about kind of what the expectations are on either side, much like really any relationship should have. But what you see is that you see kind of more codified versions of like, okay, so you are a dom in this particular dynamic, in this particular relationship, and that means therefore you're going to be the person making X, Y, and Z decisions. You're going to be the person deciding, these things that we talk about. Often it's also paired with mentorship, and kind of the idea of a dom's purpose outside of just the bedroom, because these relationships and these dynamics extend beyond the sexual play and the sexual gratification. These extend into kind of everyday life for a lot of people. And so we really get to kind of very strong mentorship relationships where, a dom's primary function is to help their sub be the best whatever role they are that they can possibly be. That doesn't necessarily mean that they're gonna like that being a sub is something you graduate out of. That's some people do, some people don't. That's their own thing, and it's their own journey, and there is no hierarchy of importance when it comes to that. But it often gets kind of paired with mentorship.
And for doctors, I think it's useful to keep track of we keep saying this, but I just want to make sure we state it explicitly at least once. These are consensual relationships. And the consent includes things like what is the dominant able to make decisions about for, within that relationship. Some it might just be in the bedroom. Some it might be, they can make decisions about what the other person eats or wears. But that's part of the negotiation that happens, and it's usually pretty explicit. And I think that's important because when we look at, just to, draw comparisons, because it can look harsh from the outside. So when you're looking at a kink relationship from the outside, you have to realize that there's kind of an external layer that everyone sees, and there's an internal layer. Just like any other relationship, right? You don't really know what happens between a married couple that's lived together for 50 years. You also don't know what's really going on inside that dominant submissive relationship. So even though things might look harsh or unfair, I think would be the usual term, like why does he get to make all the decisions? Or why does she get to make all the decisions? Or, realize that there's negotiation around that. Unlike, by the way, many vanilla relationships where those same things happen, but there's not a negotiation and it's not consensual. It's just, oh, it's just the way it's always been. So realize that this is often a way for people to take power over cultural narratives. And that's one of the cool things about kinky people is that they tend to be very creative and use cultural narratives to their own ends. And that can be therapeutic for some people. But just to say, this is consensual. And then the other thing, because this will come up later, I think, that Figaro is saying, but often isn't said even within our communities, I don't think, that's the nurturance aspect, right? It's whether it seems nurturing or not, and I think maybe this is the reason it's not talked about outside our communities very much, whether it seems nurturing or not, that's part of what it is. It's that there's this, on some level, you wouldn't as a dominant want the submissive to leave you worse than they came to you. Whether that's love, romantic, or whether it's affection, or whether it's just not giving them a horrible disease, whatever it is, like that's important. I think the reason it's not talked about as much, by the way, is because it can be really hard to see the nurturance when somebody's hitting somebody else, if that's not something you're prepared to see. So we tend to talk about safe, sane, consensual a lot, but realize that there's also this other thread of nurturance.
And so that brings up something, from how external folks outside the kink community might view a relationship. How does one distinguish then between a kink relationship and intimate partner violence? And also, for both of you, but also, in particular too, as a clinician who might be seeing a patient who has bruises that look, that look concerning. Yeah, go ahead. I'll have Figaro take it.
Yeah, I mean, I think it's really important to probe and ask gentle questions, particularly ones that are not judgmental. So focusing on behaviors or questions that you might have. Speaking as someone who's been in situations where I've had a medical professional judge me pretty harshly, the last thing that I want in a moment, especially if I were to be in a relationship that had crossed that line into intimate partner violence versus something that was consensual, last thing I need is to kind of feel judged because somebody's already going to be in kind of an off balance situation. So I think really kind of the best thing there is to probe gently around consent and be very specific to behaviors or things that you might be concerned about without without pathologizing, right? Be saying, yeah, I'm concerned about these bruises that I'm seeing here. Can you tell me, what happened and where they came from? That's a way more open question wherein you can then gauge consent, and kind of where that person is in that versus like, oh my gosh, how did you get those bruises? Like that's a bad thing, or like, or is your partner hitting you? Like any of those kinds of things can be very judgmental and can come off that way, even if they're coming from a place of genuine concern.
Yeah, it's hard, I think, as a clinician because there is this inner and outer layer. I think, though, that it's exactly right. Asking open-ended questions. The other thing to keep in mind is that for kinky people, one of their biggest barriers to coming out to healthcare providers is a fear of confusion between intimate partner violence and kink. And so we do have a lot of stories about delaying seeking medical care, or in my case, people used to drive 2 hours to come see me because they knew I wasn't going to be a jerk about it. Um, so just realize that there is kind of that aspect of it when you're asking about marks, or if you're screening, right? So most of our screening questions, we've been encouraged to get very explicit in our screening questions about abuse. And one of the questions you might ask is, have you been hit, shoved, yelled at, or and so on? And the answer for kinky people is often yes, but in a good way. So there's kind of this dance. Now, if it does come to your attention that something's going on, somebody actually says, well, yes, I am, and I like it that way, um, you kind of have your answer for the most part. You have to be a little cautious, though, because there's also abuse in kinky relationships. And it can be even, I mean, I don't want to say more devastating, but because of the breach of trust and the degree of intimacy in kink relationships, it can be particularly devastating and devastating in unique ways.
Yeah, and that brings up something that we had talked about earlier in one of our earlier conversations, and I just want to bring that up since you did bring it up, Landy, just now. But how do people discuss desires, expectations, and boundaries? I mean, that can be hard, but what is some advice that you might have to empower someone to feel more comfortable in discussing their desires or their expectations or their boundaries with their partner or with others?
I mean, for me, I think what's important to let people know and to reassure them about, if you're ever talking to somebody who maybe doesn't feel empowered to, is that they are not alone. This is not an uncommon situation. It's not easy for lots of people to talk about their desires. We're kind of taught by society at large that really, especially for folks in marginalized communities, that speaking up for what they want is a bad thing. And so, but what you can say is there is an entire community of folks out here who are banging the drum about make sure you're talking about what you want and what you need, and and kind of all of that. And I have flat out told people, if you are considering playing with someone or getting into a situation with someone and they don't want to discuss the specifics of what you'd like to get into, or they don't care what you like or what you want, it is much better and safer to just take the pass. Just don't bother with them if they are not going to respect that, because that is so key. because there are a lot of activities, and not everyone's into, the harsher things like impact play or things like that, but there are a lot of things where you have to have trust. You have to have trust that this person is going to respect your boundaries, your safety. There are kind of fetishes and kinks that can result, if done incorrectly or unsafely, can result in serious harm. And so but it all starts from that moment of, can I talk about what I want? And it may be that somebody needs to work on that themselves, or find a friend that they can work on that with before they ever consider kind of diving into a situation like that.
Yeah, I think having an explicit conversation is the way it's done. I think that in some ways the kink community has really led the idea and the development of ideas around explicit consent. If you just think about it, right? So when you say I'm into kink, you might mean I like to be peed on, or you might mean I like to be spanked, or might mean I like to dress up like a pup. And so giving somebody else blanket consent for I'll do whatever you want me to do, sir. Um, I mean, that unless you know the person really well and know what they're into, that would be a difficult consent to give. So yeah, that self-disclosure, and I think that's part of what creates the intimacy you see in kinky couples or groups, is the fact that they do have to give this disclosure about what for most people would be deeply held secrets, as far as, this is what turns me on, and that's really private, right? That's part of the reason why in the 19th century they were so interested in these people who got turned on by weird things. It's because what turns you on in Western society is seen as an essential part of who you are. And so realize that, yeah, it's hard, but there's really no way around it if you're going to do this with other people. Now, that said, you can do stuff with yourself, right, without actually disclosing to anyone. And most people, before they disclose, do things by themselves. But yeah, so I think as a clinician, letting people know that there's a community out there, and that they can connect to the community is important. You can't in a consulting room teach someone how to do kink consent. There are classes on it that the community offers. And I would say any class on kink will include at least 10 to 15 minutes in an obligatory fashion discussing consent. Demonstrations in the kink community are different than porn in that they generally include at least a simulated consent process for whatever activity. So realize that there's a lot around consent teaching within the community itself. For people who, so only 1 in 8 people who are kinky actually go to the community at any point in their kink careers. So for those people, there's a lot online that they can read. There are videos that are excellent that you can find easily on YouTube. So like the Leatherman's discussion group in San Francisco, a lot of their stuff is online. They have excellent educational programs. In the COVID era, it seems like everyone has online content, which is interesting, because it's a community that previously has been very not open to having things online, and it was relatively rare. So now it's become pretty common. So just to say, there's lots of resources, but yes, somehow you've got to learn to do that explicit consent piece to do it safely.
Yeah, and we'll definitely, try to include as many resources as we can linked to this live, so that people who are interested can follow up and look not only for educational material, but also for groups that are trusted and in the community. Something that was brought up a couple times, kind of going back to some terminology, was impact play. What does impact play mean?
Well, since I used it without defining it, I should probably define it. Um, Cardinal rule of teaching: bad, Figaro, bad. That's an example of impact play. Very, very light, of course. So impact play literally is that things were impacting. So if you're thinking of kind of more, let's say, theatrical, or things that you kind of might put in your head if you're going to an event, things like flogging, spanking, whips, canes, all of those things are considered impact play, as well as fists, punching, all that. Again, consent, and before you just jump into it, pair up with somebody who knows and learn where the sensitive parts of the body are, so that you aren't hitting them and aren't damaging somebody. But that's generally anything that has to do with something hitting something else in a way like that is going to be classed under impact play.
And if somebody is like, if that is happening, how do they communicate? Sort of like if someone's had enough, or this hurts. Is that something that's communicated between folks who are doing impact play?
Very much so. There is a wide expectation that whoever is taking the active role and let's say doing the flogging should be checking in with the person that they're working with regularly. But there are also, aside from just regular check-ins, are you doing okay, that kind of thing, there are also strategies that folks can use. The most common one that they've probably heard of, it's usually used in jokes, is safe words. Choosing a word that both parties agree to that isn't something that would generally be said in that situation so that it cannot be confused. And that is a thing that stops the action completely, very much like the director yelling cut. And then there are folks who, if they still want something really formalized, they'll use something like the stoplight practice, which is green, yellow, and red. Green is, yeah, we're good, keep going. Yellow is, okay, we're kind of running up against some things, but like, okay, but maybe let's tweak something. And red is just all out, stop. And my partner actually just educated me about kind of there's another light color that sometimes gets added when it's not a physical problem, but more of like, things like flogging can be very cathartic and very emotional. And so there is also like blue, for example, just letting someone know that, this isn't a physical problem why I need to stop, but it's like an emotional thing. That being said, the most important bit is just that both people, or all the people involved, if it's more than two people, are on the same page and understand what that means and what their language is going to be.
And I think the term came up, I think Landi may have used it, nurture or nurturing or nurturance. And maybe it was you, Figure. I don't remember who said it, but what is that, and how does that fit into kink and play?
So nurturance is not a term that's generally used in the kink community. I would say, I guess what I would say is it's something that's generally expected that nobody talks about. I use the term nurturance because it's useful to mention to clinicians who are kind of looking at this from the outside. Consent is a basic requirement. Um, but like any healthy relationship, there's usually more to it. It's not just, oh, he consented to chop my left hand off, and then he did. I think most kinky people would see that as being wrong, even if both parties agreed to it, right? Or, well, I consented to develop post-traumatic stress disorder, and so therefore it's okay. Well, no, it's not. So what I would say is that generally the expectation is not just consent. The thing that isn't talked about but is generally expected is this idea that you're caring for the other person in some way. So for example, that's seen in the expectation for aftercare. So the idea being you don't just flog somebody to tears and then walk away. You would then be expected to do something to help bring them back down to earth, whether that's snuggling or whether that's the proverbial orange juice and a cookie, whatever it is. And usually, by the way, that's part of the consent. If it's somebody you haven't played with before, would be, hey, what do you need afterwards? And nor is aftercare just, by the way, for the bottom. The top also often needs aftercare. Like if you go to a really heavy scene, realize the sadist might have some image problems afterwards, like, oh my God, am I really this monster who just beat somebody bloody? So sometimes it goes both ways. The point being, though, that there's this idea that then, you have to care for each other. Is that fair, Figaro? I don't know. It's not a term that's used in the kink community because we don't usually talk about it, but at the same time, it's really important it's there.
I agree. Yeah, it's not something that's often defined, but it's so important. I also really want to stress that aftercare, that thing or period of time afterwards is often seen as sometimes the most important thing. It is, the actual event that led up to that is really secondary to that. I mean, you've kind of, when you trust someone so much and you create an intense moment and a scene like that, you are building something together, and you can't just let all that energy come up and then just walk away. It would just be like your movie finishing in the middle if you're watching a movie. And it is really important. It's what allows people to unpack things. Maybe they had reached a moment of catharsis and are crying. And that is something that, as as someone who has been both and is both dom and a sub, depending on the situation, like I have flogged people and gotten to that cathartic moment, and it's not just cathartic for the person getting flogged. Like there's a lot of emotion that's built up there on my end too, and both people have to have a chance to kind of come out of these headspaces or the states kind of where they're in. And again, for me, this also continues into everyday life, because again, a lot of DS relationships, dominant submissive relationships, they aren't just for the bedroom. Some are, but a lot of them continue beyond that. And you know I feel like it's my job to make sure that I'm there to help the people who have chosen to be in service or submissive to me. It's my job to make sure that they're cared for, and that they know that they have a support network. Remember, a lot of people in the queer community and also the kinky community come from situations where they don't have those support networks. Maybe they were turned out by their family, or maybe they're dealing with things where again, society, representation is really still a pretty recent thing, kind of across all things. And so it's that nurturing part, even though we may not call it nurturance, you'll often hear it called mentorship, but really it is that care, that piece there. And it is, in my opinion, is an integral part of kind of the kink experience.
Yeah, and you talked a lot about the sort of dominant caring for the submissive. Realize that part of submissive do. It's not just licking boots and making dinner. Realize that part of it is also, when we talk about nurturance by the sub for the dom, it's allowing the dominant to come out of role sometimes and still be supported as a whole person. And so these relationships kind of get caricatured a lot, but it's important to realize that it's actual three-dimensional flesh and blood people who get head colds and cancer. And there is this aspect of, the dominant can't always be domly dom. Sometimes they have to have a head cold. And so the nurturance goes to that too. It's allowing, both parties allowing the other party to be a full person. And just say, I keep saying both, but for the poly people, I'm sorry, it could be all.
I know that we've kind of answered this, but I really wanted to jump on that, Landi. That is, I think that's so amazing, and even I kind of forget to mention kind of that, because we kind of get really locked into that binary. But I don't know what I would do without my partner, who primarily is in, we are in a DS dynamic, and primarily is on the kind of sub side of that. But we all are humans, and we all have emotional breakdowns at different times, and like he's been there to pick up the pieces, right? And I'm not being very much of a dom when I'm a quivering puddle on the couch, right? So it really is that kind of care that goes kind of cyclical.
I mean, it sounds it's so clear, like how important this is for people and in their lives, and bringing them joy and bringing them community. I'm just so wondering about, from both aspects, from someone who is a non-clinician and someone who is a clinician. Maybe I'll start with Figaro. Have you faced any kind of stigma in when you're seeking care from and you kind of mentioned this earlier, but either from a provider, a medical provider, a mental health provider, and maybe have you had good experiences? And then I would move on to Landi and ask, as a clinician, what are ways that we clinicians can be open and honest, and is there screening that we need to do, and how do we maintain our respect for our patients and safety? So I'll start with you, Figaro.
Yeah, I know I referenced it earlier, but I had a mental health professional who I was seeing, and he flat out told me that me being a puppy and in a DS dynamic was actually just a sign that I was trying to avoid my own problems, and wasn't healthy. And I was just like, I was honestly taken aback. I didn't. I was kind of shocked that actually, I was like, I've literally just opened up about all these things to you, and this is the reaction, like not even questions to understand, just flat out. And I walked out, and I didn't schedule a follow-up, and because it was just, I know that I have a pretty strong sense of self, but I just think about the fact that had that been somebody who maybe didn't, they could have been really crushed or tried to shove things, back down, and that can really damage people or prevent them from seeking care in the future. um, that's a thing kind of for me. uh, I have, however, had, in Chicago, and when I used to live in Vancouver as well, my primary care, folks have been really great. And part of that is that I have been very careful about choosing, uh, clinics and things like that service primarily the LGBTQ plus community, because there's a higher chance that they will have been exposed to things. So, I mean, from my perspective, the more that we can get healthcare providers exposed to things like this, the more they can actually provide, affirming and safe spaces and services to people in the community.
Landy, how about from the clinician standpoint?
Yeah, I think so. Unfortunately, Figaro's experience isn't rare at all. It's sad, but I've had people with serious psychiatric illness tell me they weren't willing to go to psychiatry because that had been a place where they had been rejected on a very profound level. Um, I think most of us, almost regardless of our sexual interests, you can imagine if you were with a partner in the bedroom and you did something and they just pointed at you and just started laughing. That wouldn't be something you could come back from. Um, and it might really be really hurtful that you carry for a long time. And so, within our consulting rooms as clinicians, we have to realize that there is that aspect of it. We are seeing people at a very vulnerable stage. Now, just to say, for the most part, patients on average are not going to come out to you about their kink interests until there's some crisis. So how can you make it clear that you're okay with it? When you take your sexual history, in addition to asking, do you have sex with men, women, or both? Or, you ask questions like this, right? By asking that question, you indicate, I'm open to hearing whatever the answer might be, right? I'm okay if you're having sex, a man having sex with men, because I asked you the question, and it's kind of normalizing. What I started doing was just asking any alternative sexual interests. And then people would look and go, what do you mean? BDSM, kink, fetish, consensual non-monogamy, poly, and then they would look at you and either go, no, but I guess you have to ask these days. Or the other interesting response you get is, why are you asking? And when you get that question, you say something along the lines of, well, because, I know it can be, for people who have those alternative sexual interests, there may be medical questions you want to ask. And if that is something, I just want you to know that I'm a safe person to talk to. And I would say 9 times out of 10, if the question starts with, why do you ask? The person saying that is actually about to disclose a marginalized sexual identity. I never write it in the chart. I'll write something like alt sex discussed, or something very vague. The reason I don't is, unlike being LGBTQ, where there are starting to be some legal protections and at least some social norms that would make it wrong to discriminate against a gay person. Kink really doesn't have that status. You can lose custody of your children still. You can lose your job. 7 state medical boards still ask about paraphilia diagnoses. And so if you happen to be a physician who's in that situation, you can imagine looking at the red flag questions where they ask you, are you convicted of a felony? And paraphilia, do you have alternative, because paraphilia is just alternative sexual practices, right? You can imagine that would, so you see this though, it can have professional implications, it can have child custody implications, it can have, job implications. So yeah, my other piece of advice is, be very careful what you write in the chart.
Thank you. And I didn't know that there was so much marginalization even legally, potential things. So how can someone who's new to this, or want to explore, I would say two things. One, someone who is new to the community and wants to explore their own sexual practices and want to stay safe within the community or want to stay safe. Where can someone go, or how should they explore that? And then my second question will probably be more for Landi too, is for clinicians who want to learn more about how to be respectful for their patients who are in the community, and be safe and open and welcoming. Where can providers learn more? So I'll start with just people in general with their own journeys. Where can people go?
I mean, I think Landy mentioned it earlier that there's a lot of online resources. You know, remember, just because you read it once doesn't necessarily make it, fact. To kind of take academic research standards here, read it a few times in a few places. But there are organizations that focus on education specifically. Again, shameless plug, Titans of the Midwest, for example, that focus specifically on kink education. And there are social clubs, and you can kind of just start your googling, wherever you are, and then leather, or whatever it is that interested you. Pups, for example, or pets have a huge presence when it comes to social clubs. If you're more a meet in kind of physical space, especially coming out of the pandemic, um, you know, a lot of the community, for better or worse, does meet up in and kind of find space in bars. And so you can look up and find, if you find leather bars, you'll generally find kind of a good confluence of folks, if that's your scene, if that's kind of your style. But there are also, a lot of forums on social media and groups, and that you can kind of find. And really, all it takes is kind of finding one person that you make a connection with, that you start chatting with, and usually they can help you find kind of other things and other people who might be a good fit for chatting.
And how about for the clinician?
So unfortunately, we don't have a lot of great resources because we don't have a lot of data, and there's kind of this emphasis on evidence-based medicine as far as teaching and writing books. CARAS, which is a San Francisco-based organization, and TASHRA, and they're closely related. I don't remember what they stand for, but they are both organizations that have heavy influence from the kink community, and they focus on training mental health professionals. But they do have a lot of information that's valuable for primary care. There's a book called Healthcare Without Shame by Charles Mosier, which is unfortunately out of print. He promises me he's writing a new one. But that's actually a really good starting point. A lot of it's dated, but it's there. And then the last thing is, if you really do want to get good at this, for better or worse, at some point you're going to have to go on the internet and at least virtually connect with kinky people who can then tell you about kink, because a lot of this isn't written down just yet. That said, I wouldn't do it at work because a lot of it is not safe for work at all. But just to say that that you really do have to go back to the community at some point, and actually listen to the people in the community.
Thank you. So many great resources and so much more to learn, and I feel like I've learned so much in the last hour. I know we're coming kind of winding down to our hour, but I wanted to ask Amanda if there were anything that has come up in the chat, or any kind of questions that have come up.
Yeah, first of all, thank you both. This has been so educational and important. But there's just a couple of questions. The first one is for like international Mr. Leather, like related things. Can women join, or any gender join?
Yeah, so I mean, I speak a lot about the leather and fetish community from kind of the male perspective because I identify as male, and so that's a lot of my experience. But we are not limited to men or those who identify as men. There are titles that are gender specific. Things like International Mr. Leather. There is also an International Ms. Leather, and the only requirements are that you feel comfortable. For at least Ms. and I can't remember, I can't speak to Mr. right now. The only requirement is that you feel comfortable representing a Ms. title for that year. Puppy play is famously not gender locked. While there are a lot of those who identify as men involved in the community, we've done a really big effort to make sure that everyone knows that, like, hey, we're humans pretending to be dogs and or cats, etc. That is not a gender locked thing. So, it really is important to know that there are resources, whether you identify as male or female or non-binary or genderqueer, there are resources and people that are in the community.
Yeah, and specifically International Mr. Leather, I mean, to compete, you have to identify as man. To go, you don't. You can get a $20 day pass, go walk around. It's an educational experience, even if you're not kinky. So the clinicians who live in Chicago, it's a worthwhile thing. You have to be comfortable seeing high degrees of naked men. And there, you won't be the other, if you go there, you won't be the only women there. So Mr. S Leather, one of their major leather workers, is in fact female. And so just realize that, yeah, even in kind of kinky gay men's spaces, as long as you're polite and not going into erotic situations, I would say, like, some people just don't want a vagina in their male erotic space. But for educational events, stuff like that, it seems to be pretty open. If you're not sure, send an email to whoever's organizing and just ask if it's okay if you go. And then for the non-gay male people, so the usual thing to do if you're looking for community and you're not a gay man going to a leather bar would be to go on FetLife, which is kind of a bottomless pit in some ways. But you look at the events and you find a local munch, and a munch is just going to a restaurant, meeting some people, usually in a vanilla non-bar space. Sometimes some of them are at bars, but most of them are at like a restaurant or a cafe. And it gives you a chance kind of just to meet people in a very low-key social situation that is not at all erotic and not usually all that educational. It's just a chance to go chat.
Awesome. Yeah, that's super, super helpful and informative. I think there's a lot of people that probably wonder how to get into that and just like ease yourself into that type of community. So that's awesome. And then there's one more question, which is if how to talk to your friends and family about this, especially if they're like, you're not sure if they're supportive or things like that. And I would just add on, this might be a separate question, but if you do have kids in a situation, like how do you have conversations with them about this and kind of open that discussion up? And yeah.
I mean, as with everything, especially when speaking about like family or parents, we decide how much we want to disclose and what our own reasons for disclosing those things are. There are some situations in which, you just like, parents don't need to know. Right. And in a lot of leather and fetish and kink, that tends to be a pretty common thing. Like, might be important for folks to know like who I go to bed with, but not necessarily what I like to do in general. There are many reasons why people might choose to disclose. For example, I disclosed to my father after I won my international title because I felt like I wanted to make sure that I had that in case someone decided they didn't like me and decided to try and out me to my family, that I had like taken care of, like taken the power away from that. But really, it's a matter of, is this something that you feel is important for you to disclose, that you want these people to know? And then, being general is kind of your friend in this situation, unless they have questions. I don't know that we necessarily need to go into very specific things unless you're planning on playing with someone when you're kind of disclosing. So, and if they have questions, great. But yeah, that's kind of where I'm at. As for speaking to kids, I'm a little lost on that one.
Okay, I'll talk about kids. And I'll talk about kids very generally. So just from a clinical perspective, you don't want to do sexualized things in front of or involving kids. And you don't want to give descriptions of sexualized things in front of kids. However, kids are pretty good at picking up on relational dynamics, meaning if somebody's always in charge, they often know who's in charge. And that doesn't have to be a kinky thing, right? So they know that even when there's no negotiation. So it's up to you how much you tell your kids about kind of the more vague stuff, relational stuff, identity stuff. As far as kids, realize that 40% of kinky people have onset of their kink interest before the age of 18 and 20% before adolescence. And so just, because we're in the annual Kink at Pride conversation season. So just realize that the kids you're talking about may already be aware of their own interests. Now that's not so much do you disclose your kink identity to them question, it's just realize that, as you think about kids, meaning young people, realize that some of them may already be realizing. And so hearing negative messaging around kink is probably a bad thing for those children. And kink is common. So about 2% of people have done some sort of BDSM activity in the last year. So realize that, it's not like this is an uncommon thing. So just because we brought up kids, just to say, realize that the kids might already be interested, may not have any way of normalizing that interest, because, the kink communities tend to quite rightly exclude people under the age of 18. So just, that's less a disclosure answer and more a just kind of let's just, as we talk about kids, let's realize that, the kids are sometimes themselves realizing that they have a kink identity.
Gotcha. Yeah, that's such an important thing to keep in mind. So important to remember that young people are so smart and do know a lot, really, really young about themselves. So that's great. Yeah, I think that's all the questions that we received. I don't know if either of you have anything maybe that we didn't talk about throughout this that you feel like is important for everybody to know, that you want to just add on.
Not necessarily something new, but just I really want to bring it back to that kind of care and communication piece. Whatever the activities are that folks get involved in, whatever specific fetishes or specific activities, that care and communication part are key. And they are kind of at the heart of it. And so, just in case there's folks who are watching or will watch this who are in a situation where they're not feeling care and they're not feeling, those pieces, like that's not generally how it's supposed to be. I'm not going to say that it shouldn't be. I'm not going to say like all the specific definitions because it's different for everybody, like all the delineations rather. But if you are not feeling cared about, and if you don't feel kind of safe in that, that's not how it's supposed to be. And it is okay to stand up for what is right for you.
Thank you. Landi, do you have any last thoughts?
Yeah, that's important enough just to say that should be the last word on the subject. That's exactly the right way to end.
Awesome. Well, thank you all so much. This has been such an insightful conversation, and I think an important one that needs to be had in a lot of spaces. So I really, really appreciate you all being here. And for those of you who are watching, thank you for being here. And if you're watching this later, thank you for watching. But just so everybody knows, I will try to put all the resources that we talked about here in the chat, and I'll put my own contact information in there. So if anybody has questions afterwards, feel free to reach out. But yeah, thank you all so much. I hope you have a wonderful Friday night or Saturday morning in Landi's case. Yeah, thanks everybody.